So thank you, Janos. I am very happy to have you as moderator of the session. So it's my great pleasure to participate in this panel. And I would like to thank all participants for this session. So I will work on talk on apitherapy in Morocco. And we have several therapy methods. In Morocco, we applied with apiphytotherapy. We have hammam therapy, massage as physiotherapy, also hijama as leash therapy, prophetic medicine, and water therapy. Because it is good to have this cocktail in order to make balance between pathologies and pollution with environmental factors. So we have also this traditional alternative medicine in Morocco with herbal medicine, and now we are working very hard with apiphytotherapy. But we have Chinese traditional medicine, Unani Tib, and we have some innovation introduced by Arab and Muslim physicians as Greco-Arab and Islamic medicine. And we have traditional Arabic and Islamic herbal medicine, which make combination with phytotherapy, apitherapy, chemotherapy, and aromatherapy. And in this context, we have prophetic medicine, Western traditional medicine, Greek medical system, and Western medical system. So it is good to have this exchange and this cocktail of therapy in order to prevent and to make curative approaches for several diseases. And we have some books in Quran. We have Hani Azromedi, and we have also some books from Kanun fi Taib and herbs from medicine. And we have the primary law of healing, let the food be the medicine. In our city fairs, we have the first Université Qarawiyyin, which had been established on 8th century. And we have very, very old manuscripts. I show you here, manuscripts of Muslim scholars like Al-Ghassani, like Al-Alami, Suleimani, and also Marrakchi. And we have in this manuscript acute and chronic pathologies, and also the therapy of these pathologies. And for us, it is a good treasury because we make a validation of this traditional use of medicine focused on apitherapy, essentially on honey, propolis, and also we have some essential oils combined as arohanes. So it is a good treasury for us to make a good scientific research with this this bibliothèque in Qarawiyyin University. It had built by a lady, Fatima Fihriya. In Morocco, also, we have very sustainable beekeeping with major flora. I will speak for the next session with honey in our region, Buplerum spinosum. It's a very good honey to treat cancer. And we have made a very good publication in this concern, also antibacterial effect. We have Ziziphus lotus, Thymus vulgaris, Juniperus, also Opensia ficus indica honey, Acacia, Tamarix, Euphorbia, and Oregano vulgar. And with this honey, we make a very good cocktail. And with COVID, we have a formulation with essential oils, with eucalyptus radiata and eucalyptus globula, and also with the Thymus vulgaris, in order to make some alternative treatments. So we have some honey from Morocco, and in our laboratory, we make some experimental data and also clinical data with some survey in all the Morocco, because I have a big project with natural products and diabetes. And we have all publications in combination, synergistic effect with honey and some medicinal and aromatic plants. So we have eucalyptus as antiseptic, and we have eucalyptus honey, very good with inhalation. With COVID, we have euphorbia as immunomodulator. We have lavandula as sedative, Capparis spinosa as hypoglycemic, and Buplerum as anti-cancer, anti-diabetic, Thymus as antiseptic, and Salvia officinalis as menopause treatment, and Rosmarinus officinalis for hepatitis, and also as immunomodulator. So very, very good kind of honeys from arid regions and from all the region of Morocco. So when we look at Euphorbia resinifera, it is an endemic plant in Morocco, family of Euphorbiaceae, and it's interacting with some cation channels that also respond to capsaicin, the primary vanilloid compound found in hot peppers. Very, very good honey. Also, Buplerum spinosum, I will speak on biomolecules of this honey. We have published more than 10 publications with biomolecules from honey and with treatment of cancer in collaboration with Spanish Council of Scientific Research. So we have flavonoids, we have polyphenols of this honey, and we treat hepatitis B, hemorrhoids, fever, and anti-inflammatory effects. We have Arbutus unido, also in Morocco, in Chefchaouen. It is very good honey to treat diabetes. Very good honey to treat diabetes. It's very rich, it's phenols, and ORAC activity is very high. We have Jujubus, Jujubier, Ziziphus lotus, Ziziphus jojoba. It's very interesting also to treat asthma and allergic rhinitis. So all these are traditional use of this honey from Morocco. For production of honey, we have increase in production with 7,430. We have export also in honey in ton and import of honey in ton. But you export honey like Euphorbia, Thymus, Lavandula. It's very, very good quality of honey. So honey for practical use, we have massage therapy, cataplasm, sea bath, by ingestion, by nebulization, by inhalation, intravenous injection, and ophthalmic and auricular eye drops. Here it's Stefan in our house in Morocco, in Fez. He is making honey massage. And it had been a very good workshop. And now we are making honey massage in all the medical schools and some workshops in order to make the route of administration of honey, pharmacokinetical properties of honey, by oral and intravenous administration in rabbits, in rats, but also we give oral honey with synergistic effect with pollen, royal jelly, and propolis. And it gives you hope to have a very, very original research. And evidence-based apitherapy, we have many scientific works in honey from Morocco, propolis, royal jelly, and bee also, because we have very good apiculture, beekeeping, which collect bee venom, and we make analysis of the bee venom, and we make acupuncture. It's very, very interesting. Here also in our house, family house in Fez, Stefan with Antonio Couto, he make acupuncture for hair loss. Here also we have microacupuncture for treating hair loss of Stefan. And in this context, we have organized conferences and symposia. On 2012, we have many international speakers with apiphytotherapy, health benefits of bee products and medicinal bee plants. And it had a very good success of this conference. Here we have all of us, Patrice, Alejandra, Stefan, Ali Timushins in beekeepers in our Moyen Atlas area. Here in medical school, pharmacy and medicine, we have Timushin, CDC, Stefan, it's a very, Alejandra, very, very good conference with all experts, Mamdouh Abdul Rahman. Here it is the ceremony for certification with Ali and Professor Touzani in Faculty of Medicine. Here we have Professor Ramdi from Arabia Saudi, CDC. We have also Antonio Couto. Here we have the exposition in Faculty of Medicine with our honey and some bee products in cosmetics. Here in our house, the closing ceremony with our folklore, and here with our ministry in our house, it's the dinner gala with Stefan, Patrice, Professor Ramdi, CDC, Ali. And here is some workshops with Antonio in our house. Here also with bench. Donc in the ceremony of closure ceremony. We have organized also the second Apitherapy, phytotherapy, Api Research for Sustainable Development with another expert and another symposium with Api Quality and Api Research. And we have this Mili Dynamics group with Christina Ozan, Antonio Couto, Patrice, Bench. May Allah have his... and now we organize on 2022 the next conference for sustainable development. Inshallah, we will be with us, Janos, Ali, and all the experts, and it should be presential in order to make ecotourism and apitourism in Morocco. We have also some formation for research and development. I am head of for master research, biological science and health on 2015 until now, and we make a small group of very good high level of students in the area of nutrition, toxicology, apipharmacopée, and apiphytotherapy. And in our farm, we make workshops for apiculture and also for valorization of honey products. We have also apiphytotherapy, health and sustainable development professional license. And now we have many cooperatives in Morocco with all cosmetic products. It's a very good as professional work and professional impact and for socio-economic level in Morocco. We have made some scientific work related to apitherapy in Morocco with our laboratory. Until now, we have articles published more than 70 and theses on honey, propolis, bee venom, bee bread, and also memories for master research, more than 50. We have scientific projects for research and innovation with Spain and our laboratory for Moroccan honey, propolis, and anti-proliferative effect, relationship between biomolecules and cancer, and we have published more publication in this context with Zenda's honey from our region. We have another big project with Paris, University René Descartes, with axonal neurodegenerescence and therapy with Moroccan bee venom. It is for a doctorate, for a lady, and another project with bee products characterization and standardization with University of Faro in Portugal. Other activities of apiphytotherapy in our staff group, api modules for professional license formation, api seminars, api lectures for biological students at Faculty of Science, Faculty of Medical School, with member of AFA and other experts in the world. We have also memories focused on bee products and cosmetics, wound healing therapeutic uses. So for honey in Morocco, you use honey for laryngite, cold in general, and also for dermatology as ulcer, gastric ulcer, and also for infected skin wound. Pollen use also for cardiovascular sphere, dermatological sphere, and also for digestive sphere. It's good, it gives a very good effect. Royal gelée, we use it for asthenia, anorexia, as immunostimulant, and also for menopause durable treatment. Use propolis for respiratory and thoracic spheres for angina, rhinopharyngite, rhinite, and sinusite, otitite externa. For stomatological sphere like candida, parodontite, dental infections. Bee venom, use bee venom now because it became popular in recent years due to the need of many patients who find little or no benefits from traditional drugs in dealing with their conditions. We have for multiple sclerosis, anti-inflammatory, anti-cancer, hepatoprotector. So practice of apitherapy in Morocco is not an approved official treatment, but it started now because it's mainly practiced by some beekeepers and some medical doctors. And we have scientific research in the field which gives hope for clinical trials in Morocco. The positive and beneficial results achieved by patients who treat apiphytotherapy for their condition in Morocco, the inefficiency and serious side effects of some chemical drugs. It is expected that apiphytotherapy is paving its way to clinical application in the future. This required multidisciplinary consortium in the field of apiphytotherapy with future participation in improving health of people as an option where it is effective while other traditional approaches fail or at least are ineffective or pose negative side effects to suffering patients. So for Morocco, it is very good because now we are working on synergistic effect of bee products, honey, propolis, and synergistic effect with bee products with essential oils. I will speak on this on Sunday with arohanes because it is used for treatment of kidney pathologies, for respiratory diseases, and it is very interesting to have this synergistic effect with biomolecules derived from bee products. And I would like to thank you very much for your attention.
Thank you very much. It was an excellent presentation, and I know you since long time, but every time you give me some new things, and I'm very happy to be with you here.
Thank you, Janos, for your encouragement. Thank you. And also Stefan, because Stefan had been the initiator of Apitherapy in Morocco. Huh? Because you should work as one community in order to promote scientific research and clinical therapy. It will be a very, very good opportunity for us, like in this online conference.
Yes, yes, I believe you. Since we don't have our Iranian colleague with us, I would give the word as next one to Mykola, to Ukraine. He is a very, very warm-hearted person, and he is also the motor for Ukraine. So we are very happy to have him here. And who will speak and who will translate, we will see. The floor is yours. Mykola, we don't see you now. We see your daughter.
Okay. So can you hear us?
Yes.
And can you see our presentation?
I asked the technical moderator, please, the presentation.
Or maybe they need to share the screen,
Okay.
Janusz?
Yes, yes, yes.
Or, yeah.
I'm looking at it, yes.
Бери телефон, щось роби.
Yes, you can.
Can you see it?
Okay, so we have.
Yes, we can see.
Is it okay?
Hello, hello.
I'm sorry.
Moment.
One moment, please.
Excuse me.
So excuse me for some technical problems.
Ми раді вітати всіх учасників конференції.
So we are glad to congratulate each participant of this conference.
Ми раді, що всі апітерапевти світу живі, здорові.
We are glad that all apitherapists in the world are happy and alive.
І ми дякуємо Богу, що є бджола,
And we thank God that there is a bee.
що ми маємо прополіс
Then we have propolis
і другі продукти,
and other bee products,
і ми їх вживаємо,
and we can consume them.
і будуть здорові наші діти, наші країни, тому що ми любимо бджолу.
And our children, our countries will be healthy because we love bees.
І дякуємо організаторів за такий дуже актуальну конференцію.
Thank you, organizers, for such a conference.
І для нас, для українців, велика честь бути разом з вами,
And it's an honor also for Ukraine to be with you,
бачити вас живих, здорових.
to see you alive and healthy.
І надіємося, що ми разом подолаємо цей ковід.
And we hope that we all together overcome this COVID.
І хто буде нас слухати, хто буде вживати і знати апітерапію, той буде здоровий і щасливий.
And the people who listen to us,
Постав.
who will use bee products will be healthy and everything will be okay.
Україна успішно бореться з ковідом продуктами бджільництва.
Thanks to bee products, Ukraine overcomes this COVID, tries to overcome.
Всі мої друзі, друзі наших апітерапевтів, хто вживав настойку прополіса 20%,
All my friends who consumed 20% propolis,
той не хворів ковідом,
those people didn't had COVID.
а наш професор Тетяна виготовляє чудові настойки, ми їх вживаємо як для профілактики, і все нормально.
And our professor Tatiana, she makes tinctures that we consume and everything is okay.
Тому я прошу вас послухати, яку вона чудово робить продукцію.
That's why we ask you to listen to our presentation to her products.
Вона розкриває вам всі секрети, як їх готувати.
She will tell you the secrets how it is
Готуйте,
prepared.
вживайте і будьте здорові.
So prepare and be healthy.
Прошу, Тетяна Михайловна.
So, Tatiana,
Чаєш? Давай, бери.
Hello, Василий Ukraine. Пандемия показала важность апитерапии. Особенно в противостоянии ковиду отлично зарекомендовала себя настойка восковой моли на продуктах жизнедеятельности, личинки восковой моли. 8 грамм на 100 миллилитров водки.
resistance of the waste products of the wax mouse larva and COVID-19. The pandemic has shown the importance of apitherapy, especially in order to resist COVID. The wax mouse tincture, based on the waste product of the wax mouse larva, or it is also called PZHVM, 8 grams per 100 milliliters of alcohol was successfully used.
Основное направление ПЖЛВ – это проблема бронхолегочной системы. Уже доказаны неоспоримые победы ПЖЛВ над туберкулезом любого типа, а также при пневмониях, бронхитах, эмфиземе. И хороший эффект дает употребление ПЖЛВ в стрессовых ситуациях и при слабой иммунной системе.
The main area of focus of PZHVM is the problem of the bronchopulmonary system. Its undeniable victories over tuberculosis of any type, as well as pneumonia, bronchitis, and emphysema, have already been proven. PZHVM make a good effect on people who are in stressful situations and who have a weak immune systems.
Все это открывает широкие возможности применения ПЖЛВ в период болезни ковидом, а также в период реабилитации. Рекомендую, учитывая артериальное давление человека, применять длительными курсами ПЖЛВ до полугода, сочетая с настойкой прополиса 20% и пергой.
All this creates wide opportunities for the use of PZHVM during the period of COVID disease and during the rehabilitation period. I recommend taking into account the blood pressure of a person to use PZHVM for long courses up to 6 months, combining 20% with propolis tincture and bee bread.
Эти пчелиные продукты чередовать месячными курсами на фоне постоянного приема ПЖЛВ. Схема приема ПЖЛВ очень проста. Количество лет равно количеству капель. Человеку 40 лет равно по 20 капель утром, 20 капель вечером, столовой ложки воды натощак за 15 минут до еды.
These two products are alternated with monthly courses against the background of constant intake of PZHVM. The scheme for taking PZHVM is simple. The number of years is equal to the number of drops. A 40-year-old man, 20 drops in the morning and 20 drops in the evening, in a tablespoon of water, 15-20 minutes before meal.
Особенно рекомендуется употребление ПЖЛВ в осенне-зимний период детям. 1 капля равна 1 году жизни. 10 лет ребенку 10 капель на ночь в водичке или в столовой ложке сока. Наверное, вы заметили, что я практически не упоминаю про личинку. В Украине пчеловоды уже давно перешли на потребление ПЖЛВ, так как ее действие намного быстрее, ярче и эффективнее.
It is especially recommended to use PZHVM in the autumn-winter period for children. 1 drop is equal to 1 year of life. A child is 10 years old, which means 10 drops before bedtime in a tablespoon of water or juice. You've probably noticed that I barely mentioned the larva. In Ukraine, beekeepers have long switched to the consumption of PZH-VM, since its action is much faster, more effective, and brighter.
И нет проблемы с заготовкой правильного сырья. Пчеловоды знают о необходимости тщательного, полноценного питания личинки. Это наличие на темных рамках перги, хитиновых коконов, меда, стихийно, без контроля пчеловода выращенные личинки и ПЖЛВ к использованию непригодны.
And there is no problem with procurement of the right raw materials. Beekeepers know about the need for an appropriate nutrition for the larva. This is the presence of bee bread, chitinous cocoons, honey on the dark, dry frames. Spontaneously, without the beekeeper's control, the grown larva and PZH-VM are unusable.
Excuse me, could you tell me to next one to find me the right slides, because right now I couldn't find which slide I should be showing to you. So is this the right slide for now?
It's not the correct slide. The slide should be number 2. Slide number 2.
Okay. So this one.
Yeah.
Okay. So when you start, I'm changing it. Okay. Thank you.
Неправильно собранная личинка. Лечебную ценность представляет личинка до 1,5 сантиметров. Лечебный эффект личинки малой восковой моли и большой восковой моли идентичен. Отличить личинку большой восковой моли и малой восковой моли можно только в лабораторных условиях. 8 суток яйцо, 30 суток личинка, дальше 9 дней куколка. Проследить развитие малярии очень трудно.
The wax mouse larva, incorrectly collected larva. Only the larva, which is 1.5 centimeters long, has a medicinal value. The healing effect of the larva of the small wax mouse and the large wax mouse is identical. It is possible to distinguish the larva of the small wax mouse from the larva of the large wax mouse only in the lab. 8 days ovicle, 30 days larva, then 9 days propupa. Okay, the next slide, please.
Проследить развитие малярии очень трудно. При частых осмотрах рамок нарушается целостность колонии. Бесконтрольное выращивание личинки приводит к потере лечебного сырья. Переросшие личинки используют для масок и кремов. Гомогенную массу личинки сразу помещают в морозильную камеру на минус 18 градусов, иначе она почернеет.
Tracking the development of mouse is difficult. With frequent examinations of the frames, the wholeness of the colony is interfered. Uncontrolled growing of the larva leads to the loss of medicinal raw materials. Overgrown larvae are used for masks and creams. Immediately put the homogeneous mass of larva in the freezer at minus 18 degrees. Otherwise, it will turn black.
Второй кадр. ПЖЛВМ. Продукты жизнедеятельности личинки восковой моли. Первые работы по изучению продуктов жизнедеятельности личинки восковой моли были проведены в Киеве в Институте медицинском имени Богомольца профессором Масютиной. И я вам даю совет. Храните нативные ПЖЛВ при комнатной температуре в сухом, темном месте, прикрыв марлышко банкой марлей. Полчища маленьких личинок при комнатной температуре доедят остатки воска и еще раз улучшат качество сырья. Срок хранения нативных ПЖЛВ 1 год. Дальше нужно сделать спиртовую вытяжку, и срок хранения будет 7 лет.
Okay, could you please open the next slide? PZH-VM, waste product of the wax mouse larva. The first studies of the metabolic waste product was carried out at the Bogomolets National Medical University in Kyiv with the guidance of Professor Masutina. Advice: store a native waste product of the wax mouse larva at room temperature in a dry, dark place, covering the jar with gauze. Groups of small larvae at room temperature will eat up the remaining wax, once again improving the quality of the raw material. Expiry date: 1 year, then make a spirituous extract. Expiry date up to 7 years, domiciliary.
Схема Лессинга применяется для постепенного входа в лечебную дозу с целью избавить сосуды от чрезмерной нагрузки при чистке организма. Актуальна схема Лессинга для маленьких детей при склонности к аллергии, при нестабильном артериальном давлении, для пожилых и ослабленных людей. Взрослые. По 5 капель утром и вечером 3 дня, по 10 капель утром и вечером 3 дня, по 15 капель утром и вечером 3 дня и так далее. Детям 1 капля равна 1 году жизни, по 1 капле утром и вечером 3 дня, по 2 капли утром, вечером 3 дня. И так идем по схеме Лессинги. Возможно, ускоренная схема по 1 дню вместо 3 дней. Капля с пипетки имеет больший удельный вес на 1/3, чем капля с евродозатора.
So could you please, the next slide. Ladder scheme and the next one. Yeah, ladder scheme. It is used for a gradual entry into a therapeutic dose in order to relieve the vessels from excessive stress when body clearance. It is relevant for children with a tendency to allergies, with unstable blood pressure, for the elderly and weakened people. Adults, 5 drops each morning and evening for 3 days. 10 drops each morning and evening also for 3 days. 15 drops each morning and evening 3 days. 20 drops each morning and evening 3 days. Further, the dose depends on the weight. Then, children, 1 capsule means 1 year of life. 1 capsule in the morning and in the evening, 3 days. 2 drops in the morning and in the evening during 3 days. 3 drops in the morning and in the evening, 3 days in a tablespoon of water, 15-20 minutes before meals. It is possible also an accelerated scheme, 1 day instead of 3. A drop from a pipette has a greater specific gravity by 1/3 than a drop from a Euro dispenser. 20 drops from a pipette is equal to 30 drops from an Euro dispenser.
Журнал «Доктор Би» – это современный украинский журнал, который объединяет апитерапевтов, апиконсультантов и тех, кто стремится жить здоровым. Журнал публикуется 1 раз в квартал и распространяется под подписки. На своих страницах апитерапевты делятся своим большим опытом в лечении заболеваний с помощью апи-продуктов. Наш журнал имеет собственную веб-страницу, где вы можете найти журнал на английском, немецком и украинских языках. Ссылку вы видите. Приглашаем вас стать частью веб-подписчиков электронной версии. Thank you. Thank you.
So Dr. B magazine is a modern magazine that unites apitherapists, apiculturalists, and those who strive to live healthy. The magazine is published once a quarter and is distributed by subscription. On their websites, apitherapists share their extensive experience in treating diseases with the help of bee products. Our magazine has its own website where you can find magazines in English, German, and Ukrainian. So you can see the link. Will you please open the slide, the next slide? And we invite you to become a part of the web subscribers of the electronic version. So, and the next slide, please.
Алло, Януш.
Yes, thank you very much for the presentation. There is one question or two. The first question coming from Mustafa, and he asks you, are there research articles and results on the usage of honeycomb wax moth larva and propolis mixture against the COVID-19? Do you have any scientific research articles about this?
Стосовно використання ПЖВМ відповідно в лікуванні COVID.
Татьяна Михайловна, вопрос о том, хто сейчас у нас в Україні досліджує личинки воскової діяльності, продукти життєдіяльності личинки.
Харьковский фармацевтический университет, есть кафедра апитерапии под Олег Сергеевич, там работает вместо Александра Ивановича, который умер. Сейчас не вспомню, как фамилия его. Кафедра апитерапии, Харьковский фармацевтический университет. Было сделано ДСТУ, и сейчас мы его возобновляем, восстанавливаем. Оно давно уже было сделано. Есть ДСТУ, вот, есть ДСТУ на продукты жизнедеятельности.
Сейчас на стадии исследования.
In Kharkov, we have Farm University that provides some researches, and there is a separate development, a separate cathedra that is called Apitherapy, where the researches are held.
Олег Шпичак.
So the name of
Под
this,
руководством профессора Олега Шпичака.
Да, Олег Шпичак.
the leader is Andrei Shpichak.
Но Татьяна Михайловна Чукрай, доктор Татьяна Чукрай, занимается жизнедеятельностью личинок уже более 20 лет. И у нее есть успешные, подтвержденные на многолетнее лечение людей.
Продукты жизнедеятельности были представлены на конгрессе Апимонди в Киеве. Я их лично представляла в VIP инновациях. 2013 год, Апимондия, Киев.
Yeah. So she says that in Apimondia in Kiev, she made a presentation, and this is, I think, is available on the Apimondia webpage in English.
I think this technique is not very much used other than Ukraine. So that's why in this session we are we thought that it might be interesting for the participants while they are listening about apitherapy in Ukraine. That can be an interesting presentation because I don't know, Janusz, have you seen this somewhere else?
Well, I tried it in Hungary because I was impressed from the Ukraine praxis. And if you go in the research center of the academic research center of B, at the entry, there is a big market. And the people sell wax moth larvae in jars. And I remember during our trip after the Apimondia, we was visiting several apiaries with Theodore Cherboulier, and we have seen also the jars full with the wax moth larva, and I tested it, and I can say you, it has a unique test. And but I have a question to the presentation. Is it possible to ask her? On the second slide, you say bigger than 1 centimeter is not good. But on the picture, we see wax moth larva, which is bigger than 1 centimeter.
No, it was from 1 to 5 centimeter. They said that it's okay.
Oh, it's okay. Okay, so not bad. It's okay. Okay.
I think that is, yeah. So we are in a session, apitherapy in different countries. So it is very interesting to when we listen about apitherapy in Ukraine. Because, as I said, I don't know if it is available so common in somewhere else, and I think also we have to mention here when we speak about apitherapy in Ukraine, also Dr. B magazine, which is from Ukraine, so and it is spread to many countries as well. I wish success to Dr. B magazine as well with this opportunity.
Ми дякуємо.
So we thank you.
Ми запрошуємо всіх апітерапевтів об'єднатися
We invite all the apitherapists to join
і показати всьому світу, що бджола лікує людей.
and to show the whole world that bee can treat everyone.
І можна так сказати, що ми дякуємо ковіду що ковід, що тепер люди по-другому дивляться на бджолопродукти.
And we can also thank COVID because of this disease, people can see on bee products from the other side.
І якщо раніше, 2 роки назад і більше, дуже ставилися скептично до прополіса,
2 years ago, the people were very skeptical to the propolis.
то зараз на прополіс великий попит,
But now they use a lot of propolis.
на мед.
They use a lot of honey.
І завдяки таким народним цілителям, як професор Тетяна, і є попит на личинки воскової молі, на воскову моль, на життєдіяльність продуктів.
And thanks to such people as Tatiana Chukrai, we use a lot of honey, a lot of larvae. So thanks such persons.
А також завдяки таким людям-ентузіастам, як Аліті Мучин, Стефан Стаганаці, Джеймс, Януш Рад, наші китайські друзі, Пушпендера, який сьогодні виступав, Томас Глогер і багато наших друзів. Ми будемо всі здорові, і хто буде слухати наших лікарів, апітерапевтів, той теж буде здоровий.
And thanks to the organizers, to Aliti Muchin, Janusz, Stefan, James, and our Chinese friends.
Наша подруга Бадія із Марокко.
Our friend Badia from Morocco.
Наші любимі доктора із Румунії, Габріела.
Our dear friends from Romania, Gabriela.
І ми желаємо вам всім здоров'я, удачі і всього самого хорошого.
We wish you the health and everything good.
Yeah. Janusz, if you allow me, I saw one question from our attendees. It was if they can repeat how they made that solution exactly, like 8 grams of larva, how much alcohol. So
I answered this in written way. They made 10% and 20% of the larva extract. How many percentage of the alcohol? Is it 40 or 70?
Тетяна Михайлівна, запитання до вас. Скільки відсотків має алкоголь в настої?
40 градусов. Даже 38-40 градусов. Не нужно ничего перебарщивать.
38-40%.
На водке. Не на спирту, а на водке.
Just to finish it, I'm very glad to be here with Mikola and with Badia on this session. And we are very sad that our Iranian friend is not present. Do we have a pre-recording of him? No.
I don't think so. So if there is any question about this method in Ukraine, we can refer to Dr. Tatiana. So if it is okay for her, they can make researches, further researches. Can you translate this, please? If there is any people who wants to make researches, we can refer to Dr. Tatiana, I think. Is
Yes,
it okay?
I will be happy to collaborate with Dr. Tatiana.
Okay, very
it
good.
is the first time I saw this. It is very good. Perhaps I invite you to Fez to make a workshop for this for apiculture because it's subproducts. It's valorization. Valorization of subproducts. It's very original.
One of the opportunities that we want to create in the Congress is joint projects, multi-center studies. So it will be good. Ukraine, Bedia, Professor Bedia Lucy from Morocco and Professor Tatiana from Ukraine, they can work together if the moderator allows.
Yes, of course.
Okay,
Yeah,
thank you.
And Janos will be the supervisor. Janos, you will be the supervisor of our project. Okay.
He's the moderator, so he should.
Okay. So by this way, I thank for everybody to being here. And I think we have to give the floor for the next session. And we are very happy and good luck, good health.
Okay.
Thank you.
Be together.
Thank you.
Thank you, Janos.
Thank you.
Thank
Bye.
you all.
Bye.
Professor Badia, Professor Tatiana, Mikola,
Bye.
and Ohala. Ойла.
Спасибо.
Thank you, спасибо.
Дякуємо всім
Thank
друзям,
you, Stefan.
всім здоров'я, всім удачі і щоб були здорові. І
Happy for
вживаємо
our collaboration with magazine B. Magazine B. It's very good to make
Yes,
some.
we should support.
Yes, yes. Thank
До
you.
свидания, Никола. До
Take
свидания.
care. Take care. Take care. Bye bye.
Bye-bye.
Bye-bye. Bye-bye. Bye-bye.